Hi, I'm Gina Boswell, and I will be discussing project management, and will also discuss a project that I would like to implement. Project management is needed to help certain projects remain on budget and completed in a certain time frame. The project manager is pretty much the go-to person. They're involved in every aspect of the project, and they need to know the workings of every part of it. They basically need to know everyone's job. It's important for anyone, especially nurses, to be prepared and ready to handle any type of situation at any given point in time. I personally would like to incorporate an electronic birth simulator mannequin into the yearly competencies and education with OB nurses. Having worked in OB for 4 years, I probably have only experienced 1 to 2 serious emergencies. I had only had experience from reading about these emergencies. We do kind of drills in the hospital, but they were usually fake, on fake patients, pretend people, so you didn't really get that full hands-on experience. By purchasing a mannequin, you really get the experience of actually delivering a baby in an emergency situation. Mannequins can have a normal vaginal delivery, a difficult vaginal delivery. They can experience maternal hemorrhages, cardiac arrests, and also the baby can experience neonatal emergencies. All stakeholders would benefit from purchasing this mannequin. The hospitals, the doctors, the nurses, and other staff, as well as the patients, would benefit. Everybody would feel a little bit more comfortable. They would get to practice in non-life-threatening emergent situations so that when the time comes, the doctors and staff can work together and know how the other one works. Getting to know each other's strengths and weaknesses prior to an emergency situation definitely helps when the time comes. Knowing if I start IVs really good, or if this person over here is really good at calming patients before the emergency situation happens, we kind of will know our roles when it comes. The mannequins vary in price from a few $1,000s to about $40,000, depending on what you need for how high-tech you want to get. After discussing, the budget with the hospital and determining what would be appropriate, I would like to purchase this mannequin and have everybody trained, the staff perform an initial competency on it within about 4 months. After that time frame, I would like for them to have yearly surprise drills, and this way it can be more realistic. Place the mannequin in a patient's room and have a code, emergency C-section or maternal hemorrhage, and have the whole staff that would normally be involved in this drill all present and go through it as though this were a real patient. By doing this, it really will help the staff and doctors work together to help the patient, in the non-life-threatening situation. Whereas when it comes time to it, they know what to do, they know what they're doing, what it will result in, and the mannequin, depending on how the staff responds to the situation, the mannequin will either get better or the current situation will worsen. The newborn can also, after the delivery, can also turn nice and bright pink if you're doing what you should do, or it can continue to turn blue and get worse, and then that lets you know that you're not doing your skills appropriately. It will help you to know what to do next. I'm sorry. Hopefully, my goal is if everybody can get competencies done in this, the end result will result in happier patients, healthier patients, less hospital stay, and less NICU admissions. Thank you.